Good morning, I'm Mabel Zhang, and you're watching the World Healthcare Congress Interview Zone. This morning I'm joined by Ting Shih, who is the founder of ClickMedix, and she's doing a lot of very interesting work with Grameen Health Innovations. Good morning, Ting, how are you?
I'm fine, thank you.
Well, the last time we met, back last year, you were just starting to get to know Grameen Health Innovations, Professor Mohammed Yunus, who is behind Grameen, and also getting more information about what they wanted to do with their company. You've come a long way. Tell me, give me an update on what's happened.
Sure. I first learned about microfinance when I was a graduate student at MIT, and I thought it's a developing country effort. Had no idea Grameen banking is actually in the US, in fact in New York, and they serve about 10,000 women who are low income, but they are very successful entrepreneurs. They start with a $1,000 loan, and that's how they start building their business, which could be a fruit stand that grows into a fruit chain, and tortilla stand, and they really grow from there. They have 99% payback rate. And one of the models that's enabling them to do that is the Grameen model, which is every weekly visits, every weekly meetings where they repay back their loans, but they're also in groups of 5. And every one of them is accountable for each other. If one of them does not pay back the loan, there are some penalties within the team. So, and all the members are within literally a 5-minute walking distance from each other, so they can also see each other almost on a daily basis.
Right.
So we thought, what an incredible model for keeping compliance for typically non-compliant population and really helping them manage their finances. So what if we could do that for healthcare? So what we've developed is a way of leveraging the Grameen model using community-based efforts, hiring community health coaches within their own peer group, and also teaching them about health habits and teaching them about how to improve their health and understanding diseases. We're also building a clinic in the Queens, Jackson Heights area so that they have a community clinic where they can go and see their own doctors, very much mimicking or paralleling the financial model that's giving them ability to grow their businesses and become very compliant.
Now, how many women have you identified already as strong candidates for the Grameen Health Innovations model?
So initially, we are starting with a pilot cohort of 600.
And when is that starting?
Around June, July timeframe.
Okay.
And we've done an initial assessment through a health fair. Over 100 people attended the health fair. And what was fascinating is we've asked questions such as, do you think you're healthy? Almost 90% and above said, it's at least good or better. But when we looked at their BMI measures, they're actually overweight or obese. And so we realized there's no correlation, perhaps a knowledge gap between obesity and prevalence of diseases, as well as their family history and genetic factors that are likely prone for them to have diabetes, hypertension, if not now, but later down the line.
Okay. And in terms of your work, specifically ClickMedix, how are you involved?
So we are the connected health technology that allows them to gather initial assessment information, tying that to the patient themselves, and then allowing the health coaches to collect information on the ClickMedix app, and then allowing the health worker to record information on their diet, on their lifestyle, on their treatment, on their diagnosis, and really following up on a weekly visit to make sure that they're adhering. And we're also equipping them with a number of tools for the health coaches. So this literally becomes a clinic on the go for the ones, for them to look at ENT, ear, nose, throat issues, if there are any acute symptoms, blood glucose information, digital stethoscope for some of the metrics, and tying that into their whole patient profile, which then can be reviewed by doctors within the community clinic.
So really bringing healthcare to their doorsteps.
Exactly. This model has been done in a lot of developing countries, very effective, very cost effective in places that are low resource. In today's world in the US, we are low resource and cost of healthcare is really expensive. So we're really looking at migrating healthcare to the patient's home, also helping them self-manage, coaching them on lifestyle changes that are really effective in terms of keeping them healthy, and doing some of the remote care through remote supervisory physicians and send them to the clinic if they need the physical care and some of the treatment.
In terms of cost, how much would a woman need to pay to be involved with the new clinic with Grameen?
So staying aligned with the social business model, they are paying about $45 per month. So that is self-sustaining for the clinic after the initial build up the clinic, as well as the tools and the ClickMedix connected health system.
Is that for themselves and their families?
We're still determining what that package rate is for the family.
Okay. And in terms of accountability, this mobile health unit will be able to follow up with people to make sure that they're doing what is recommended for them?
Exactly, and also empowering a community-based health coach to be the conduit of care, teaching the family members about how to care for themselves.
Okay, and this pilot program starts in the summer of 2013 at some point?
Yes, that's the current target date.
All right. Ting, it's exciting work, and we look forward to getting another update from you next year.
Thank you so much.
Thanks again. And I'm Mabel Zhang. Thanks for watching.